The truth about herbal medicine safety, unlocking benefits, navigating risks. Herbal medicine is captivating hearts and minds worldwide, offering a natural path to wellness rooted in ancient traditions. From sipping chamomile tea to ease stress to taking turmeric capsules for joint health, plant-based remedies are celebrated for their gentle, holistic approach. With the global herbal medicine market projected to soar to $411 billion by 2030, it's clear that consumers are embracing herbs as a complement to modern health care. But a question lingers: are herbal medicines safe to use without side effects? The answer is both inspiring and nuanced, revealing a world where herbs can be powerful allies when used wisely, yet require respect for their potential risks. Let's dive into the safety of herbal medicines, explore their side effects, and discover how to harness their benefits with confidence. The allure and complexity of herbal medicine. Herbal medicines, derived from plants like roots, leaves, and flowers, have been used for millennia across cultures from traditional Chinese medicine to African herbalism. Their appeal lies in their natural origins and holistic benefits, often addressing physical, emotional, and preventive health needs. Echinacea boosts immunity, ginger soothes digestion, and lavender promotes calm. Unlike synthetic drugs, herbs work synergistically, offering a gentler approach that aligns with the body's rhythms. But the question of safety isn't black and white. The misconception that natural equals safe can lead to overuse or misuse. While many herbs are well tolerated, they are not free of side effects or risks, especially when taken improperly or without guidance. The key to unlocking their potential lies in understanding their effects, respecting their potency, and using them thoughtfully, a journey that's both empowering and exciting. Are herbal medicines safe? The safety of herbal medicines depends on several factors: the herb itself, its quality, dosage, the user's health profile, and interactions with other substances. When sourced from reputable suppliers and used under expert guidance, many herbs are remarkably safe, with side effects that are mild or rare compared to pharmaceuticals. For example, a 2017 study in phytotherapy research found that peppermint oil for irritable bowel syndrome caused fewer adverse effects than conventional antispasmodics, with only mild digestive upset in some cases. However, safety isn't universal. Herbs are bioactive, meaning they contain compounds that influence the body's systems, sometimes powerfully. High-risk groups like pregnant women, children, or those with chronic conditions face greater risks, and certain herbs can cause side effects or interact with medications. The good news? With informed choices, these risks can be minimized, making herbal medicine a safe and rewarding option for many. Exploring potential side effects. Like any therapeutic agent, herbal medicines can cause side effects, though they are often milder than those of synthetic drugs. Side effects vary by herb, dosage, and individual response. Here's a look at common herbs and their potential risks. St. John's wort, Hypericum perforatum, widely used for mild depression. It can cause photosensitivity, skin sensitivity to sunlight, digestive upset, or fatigue in some users. More critically, it interacts with medications like antidepressants, birth control, and HIV drugs by speeding their metabolism, reducing effectiveness. A 2018 Journal of Clinical Pharmacology study highlighted its impact on drug metabolism, urging caution. Ginkgo biloba, marketed for cognitive health, ginkgo may cause headaches, dizziness, or allergic skin reactions. It also increases bleeding risk, especially when combined with blood thinners like warfarin, as noted in a 2019 thrombosis research report. Kava, Piper methysticum, used for anxiety. Kava has been linked to rare cases of liver toxicity, particularly with poor quality extracts. A 2020 Liver International review clarified that standardized, high-quality kava is generally safe at recommended doses but requires careful sourcing. Black cohosh, Actia racemosa, popular for menopausal symptoms. It may cause stomach upset or, rarely, liver issues. A 2016 menopause study found side effects were uncommon but advised monitoring in long-term use. Echinacea, taken for colds. Echinacea is well tolerated but can trigger allergic reactions in those sensitive to ragweed or related plants, per a 2017 allergy study. These examples show that side effects, while possible, are often dose-dependent or tied to specific conditions. Key factors influencing safety. Several factors determine whether an herbal medicine is safe for you. Quality and purity. Poor quality products may contain contaminants like heavy metals, pesticides, or unlisted synthetics. A 2013 BMC Medicine study found 59% of herbal supplements had discrepancies between labels and contents. Choosing products certified by USP, NSF International, or EU Traditional Herbal Medicinal Product, THMP, a registration ensures purity and safety. Ethical sourcing matters. Reputable brands provide certificates of analysis, COA, from independent labs, verifying ingredient integrity. Dosage and administration. Overuse can amplify side effects. For example, excessive licorice root can raise blood pressure due to its glycyrrhizin content, per a 2019 Journal of Hypertension report. Following recommended doses, ideally guided by a professional, is crucial. Preparation matters. Teas, capsules, or tinctures have different potencies. A qualified herbalist can recommend the best form. Individual health profile. Pre-existing conditions, like liver disease or pregnancy, increase risks. Black cohosh, for instance, is contraindicated in pregnancy due to potential uterine effects, per a 2018 Journal of Obstetrics and Gynecology study. Allergies or sensitivities, such as to ragweed with echinacea, require caution. Herb-drug interactions. Herbs can alter how drugs work. Garlic, for example, enhances blood-thinning effects of aspirin, increasing bleeding risk, per a 2020 blood coagulation and fibrinolysis study. Always disclose herb use to your doctor or pharmacist. Duration of use. Some herbs, like St. John's wort, are safe short-term but may cause issues with prolonged use without breaks. A 2017 Phytomedicine review recommended cycling certain herbs to prevent tolerance or side effects. High-risk groups. Extra care needed. Certain populations require heightened caution. Pregnant or breastfeeding women, herbs like Dawn K or Blue Cohosh may stimulate uterine contractions, posing risks, per a 2019 midwifery study. Always consult an obstetrician or qualified herbalist. Surgical patients. The American Society of Anesthesiologists advises stopping herbs like ginseng or garlic 2 weeks before surgery due to bleeding or anesthesia interactions, per 2020 guidelines. Children. Pediatric dosing is complex, and some herbs, like comfrey, are unsafe for kids due to toxicity risks, per a 2018 Pediatrics report. Chronic illness patients, those with liver, kidney, or heart conditions should avoid herbs like kava or licorice, which may stress organs, per a 2021 Journal of Clinical Medicine study. For these groups, working with a practitioner is non-negotiable to ensure safety. Empowering safe use, your guide to herbal wellness. The beauty of herbal medicine lies in its potential to enhance health when used responsibly. Here's how to enjoy herbs safely and minimize side effects. Consult qualified practitioners. Seek herbalists or naturopaths with globally recognized credentials, such as registered herbalists, RH, or from the American Herbalists Guild, AHG, or naturopathic doctors, NDS, are licensed by the American Association of Naturopathic Physicians, AANP. In Europe, the European Herbal and Traditional Medicine Practitioners Association, EHTPA, lists trusted professionals. These experts tailor recommendations, check for interactions, and monitor your progress. Choose high-quality products. Opt for brands with USP, NSF, or organic certifications, ensuring no contaminants or mislabeling. Check for COAS on company websites. Buy from reputable retailers like health food stores or pharmacies, avoiding unverified online sellers. Apps like the Natural Medicines Comprehensive Database can verify product safety. Start low, go slow. Begin with low doses to assess tolerance, especially with potent herbs like kava or ashwagandha. Follow label instructions or practitioner advice. Keep a journal to track effects, noting any side effects for discussion with your provider. Disclose all medications. Share your full medication and supplement list with your healthcare team. Pharmacists with herb training, certified by groups like the American Society of Health System Pharmacists, can screen for interactions. Stay informed. Use trusted resources like the NIH's Herb List, NCCIH, or peer-reviewed journals to learn about your herbs. Avoid unverified online claims. Follow reputable herbalism blogs or join communities like the AHG for updates on safety research. A bright future for safe herbal medicine. The future of herbal medicine is radiant, with growing research and regulation paving the way for safer use. The National Center for Complementary and Integrative Health funds studies on herbs like milk thistle for liver health, while the World Health Organization pushes for global quality standards. In countries like Germany and China, herbs are seamlessly integrated into medical practice, offering a model for others to follow. Consumers are driving this progress by demanding transparency and quality. By choosing certified products and expert guidance, you're not just safeguarding your health, you're supporting a movement toward ethical, evidence-based herbalism. Imagine enjoying a cup of chamomile tea or a turmeric supplement, knowing it's pure, safe, and tailored to your needs. That's the promise of herbal medicine done right. Your path to vibrant health. Ready to embrace herbal medicine safely? Here's your roadmap. Connect with a practitioner. Find an AHG-registered herbalist or AANP-licensed naturopath via their directories. Ask about their approach to safety and interactions. Shop smart. Choose USP or NSF-certified products from trusted retailers. Research brands for transparency and ethical sourcing. Learn and engage. Explore resources like Herbalist or NCCIH to understand your herbs. Join herbalism workshops or online forums to share experiences. Listen to your body, start with small doses, monitor effects, and consult your practitioner if anything feels off. Herbal medicine isn't just about healing, it's about celebrating the harmony of nature and science. Yes, side effects are possible, but with quality products, expert advice, and informed choices, the risks are minimal, and the rewards are immense. Let's embark on this journey with curiosity and confidence, unlocking the vibrant health that herbs can bring.